Taking care of your neck and your back's health is important. Just ask anyone who's suffering from degenerative disc disease, sciatica, or any of those other painful maladies.
Yeah, many who find themselves suffering from that pain have found relief at Total Health Chiropractic and their non-invasive DRX 9000 program. Take a look.
Well, Todd, dentists have taught us well that it's very important to maintain our oral health by not waiting until you have, tooth pain, but, most people understand they need to brush and floss a couple times a day, see the dentist for periodic checkups, because if you don't, you're probably going to get cavities and a bunch of problems in your mouth. But a lot of people aren't aware the same thing can happen to our spines with stress and neglect in our life, but they actually can rot and decay if we're not doing healthy things to take care of it. So these models show different stages of spinal decay or degeneration. This is what normal looks like. You can see this progression, but the last stage is actually the point of no return. If people wait that long, there really are no options to reverse it. But starting with normal, here you have very nice movement in the joint. This is the intervertebral disc between those bones, and it's very thick, and that gives this nerve plenty of space. But also a healthy disc should be like a wet sponge where it provides shock absorption. So you can see here that affects that way here, where there's squishy and shock absorbing effect. But with stress in our lives, you can get to stage 1 where now that bone is stuck out of alignment, not moving very well. If that's not resolved, our curves can start to change. These discs actually start to dry out and then degenerate down, which is degenerative disc disease. As these bones get closer, it starts encroaching on that nerve. But if things are allowed to progress, more people start having problems in stage 2, where now that disc is really degenerating and thinning down. You can see how choked and pinched that nerve is. This is also the stage we start seeing spinal arthritis, which is bone spurs growing off the vertebrae. Also, not only is that nerve pinched, these brittle discs can lead to bulging or herniated discs where they're pushing into the nerves. And not only that, you can see how very brittle and hard that disc is, where it's not absorbing shock very well. These people usually are getting quite a bit of pain. But the last stage, as I said, is the point of no return. And the reason this is such a problem is when those discs degenerate to the point the bones or the spurs touch, these vertebrae actually fuse themselves together and grow into a solid block of bone. And when that happens, there's no movement at all. Basically a permanently pinched nerve that never goes away. These progress over years and decades. Sometimes the first symptom, you're all the way down here close to the end. And then it can take a lot of work to reverse that. So we just encourage people to be proactive and get their spines checked early on to prevent this process from happening. Some indicators that they may notice, obviously chronic neck or back pain would be one, but other things could be things like popping or grinding of the joints with movement with the neck or lower back. Sometimes frequent muscle spasms or Charlie horses. Maybe not even the spine. That could even be in the arms or the legs, because that's where those nerves are traveling to. Because symptoms don't start till later many times, and this can affect our overall body health and affect us systemically, I do have a pretty great chart I wanted to show you that explains that. Cells, tissues, and organs in our body are controlled by our brains, and it will send those instructions down the spinal cord and out these nerves to whatever they control. You can press these different buttons for the different nerve levels and actually see what's being controlled by those nerves. So the problem that we find with a lot of patients is they have nerve irritation or pinched nerves. It can do much more than just cause neck or back pain. It's more like a dimmer switch on a light, or if you crimp a hose and that flow of water changes, because from that point on, the message going out can be diminished, it can be changed. Sometimes that's blocked completely. So now when these organs and tissues are not getting the information that they need to work properly, they work less efficiently, they can malfunction, and patients can have some serious problems health-wise throughout their body, more than just neck or back pain. So Todd, we treat a lot of different conditions here, obviously neck and back pain, but what causes that are things like degenerative disc disease, as I explained earlier. We can help people with bulging or herniated discs, spinal stenosis, which is crowding of the nerves. It can even be sciatica, and a lot of times people that have had failed neck or back surgery, we're able to help them as well. A lot of patients we get are taking medications daily, they've done physical therapy, they've done shots at the pain clinic, facing surgeries, and they're not real excited about that because they're all very invasive and can have some negative consequences and side effects as well. Everything that we do here is non-invasive. We're not doing any cutting or shots or surgery, and we work on actually getting the spine and the discs healthier so that they can get out of pain, because we're getting their backs and their spines healthier. And Todd, since you're here, why don't we go take a look at the DRX and I'll explain how that works. All right, Todd, well, this is our DRX 9000C medical device to help regenerate injured discs. And when they made this machine, they made it for great results, but also patient comfort, because a lot of patients are having quite a bit of pain as they're initially starting the program. I mean, that's why they come to us. So for the lower back, we have harnesses that we put around their hips and midsection. They step up onto the platform here, and they lean back against the table. This actually lowers them down onto their back so they don't have to climb up onto it that way. Once they're on their back, we put a big pillow underneath their knees to take pressure off their back. And this actually has an air bladder in the table that we inflate to support their back. But once they're comfortable, we connect the upper harness to the top of the table here. The lower harness we clip to this. Now, Todd, that strap goes down into the motor. Computers are connected to that and they control that motor. So we program all the patient information in the computer. And this is very specific to one level at a time. We just select the level with the buttons here and then we start it up. It's a mild, gentle pull, and when patients are on it, it's usually about a 30-minute session. They could be on their phones, they can listen to music. The majority of patients actually just take a nap and sleep because it feels good. Pain is being relieved. Todd, we encourage people not to wait until they have symptoms. The best way to determine if they're having problems is to come to our office and actually get their spines checked with a thorough exam and maybe some x-rays. So we do have a great special for your viewers. If they'd like to get checked and see what we can do to help them, for $60, we'll do a consultation and a physical exam of their spine. And then I do have a special, the first 4 people that schedule that appointment, they're going to get a free copy of my book, The Back Pain Solution. There's a lot of great tidbits in there they can learn to get healthier and get back on track by themselves.